Hello, my name is Dr. Michael Codsi, and I'm an orthopedic surgeon at the Everett Clinic here in Everett, Washington. And I want to talk to you about some of the treatment options for rotator cuff tears. So let's look at a typical tear here. This is the ball of your shoulder joint. Here's your arm bone right here. And this tendon right here on the top of your shoulder is your supraspinatus tendon. And that is the most commonly torn tendon in the shoulder. So let's just show a little tear here. And you can show here's the other side where it tore from. And there's a separation of that tendon there. And when that tendon's not attached, you can lose strength and, more importantly, have pain. The most common complaint of patients with rotator cuff tears is pain. So when you're thinking about your treatment, you have to think about your goal. And so if the goal is to get pain relief, there are two options to treat your pain. And the first option is therapy. And the second option here is surgery. So if you want to get pain relief, therapy can relieve pain in about 50% of patients here who try therapy get really good pain relief from this. And it usually takes about 3 to 6 months of therapy. So it's not a quick fix with either of these treatments. Unfortunately, rotator cuff tears do take a little while to recover from. Now with surgery, you have about an 80% chance of getting pain relief. So slightly higher than therapy, but as you'll see, there's a lot of other things to consider with this. And the recovery from surgery is a minimum of 6 months. It's a minimum of 6 months, and can often take 9 months to recover from, especially if you need to lift things up overhead. You're a worker who does a lot of working up overhead or pushing and pulling heavy objects. Now, the other thing to consider is healing. So if your main concern here is not just pain relief, but it's healing of that tendon, this is a whole different ball game here. So let's see now. If you want this tendon to grow back to this bone, it will not do so on its own, because see this muscle here, it only pulls in one direction. All these fibers pull this way, and it pulls that tendon here away from where it's supposed to heal. So it will not heal on its own, and the only way to get it to heal is to do surgery. So surgery is the only way this will heal. It will not heal with therapy. And what you have to do is you have to take this tendon here, which is torn, and you have to put these little screws or anchors into the bone, and they have little things on them to keep them in the bone. And then you can put these little sutures that go through the tendon here and back down here. And so we can put another one here like this. And then when you tie that down, this tendon comes all the way over up on top of the bone right here. And you have to hold it there in order for it to heal. So that means you have to be in a sling for at least 6 weeks. And you can't do any reaching or pulling or pushing with that, because every time you do that, you'll pull this tendon away from these stitches. And if you do that before it heals, this thing will not heal. So you do have to consider 6 weeks in a sling, and you'll probably be limited with how much you can lift there for at least 3 months before you start any strengthening on that shoulder. So with therapy, you can start doing some lifting right away, but of course you do have to wait for that pain relief to happen. One of the other risks that you have to consider, these are the benefits, pain relief and healing, but the risk that you have to consider with therapy is there is a chance that the tear can get bigger. So these tears, like I said, they do not heal if you do therapy. They don't heal on their own, so they have a chance of staying the same or getting bigger, not getting smaller. So that is something that you do have to consider, and I'd say for a really small tear, you probably shouldn't worry about that too much. If you have a good sized tear, though, the chances of it getting bigger are larger. And with surgery, like I say, you have an 80% chance of this thing healing. But that means 20% chance where it doesn't heal. And if you have a big tear, meaning this tear extends all the way over here, let's say instead of 1 centimeter, it's about 3 or maybe even 4 centimeters, well, then your healing rate goes down from 80% to maybe 50%. And if it's a big, massive tear and the muscle that's attached to it, instead of being this big muscle right here, let's say that muscle gets a lot smaller, and it's only maybe this big, and your tear is pulled all the way back to here, so the tear edge is way over here. That means you got to pull this all the way back, and you got to hope that this muscle can stretch all the way with it. And so the bigger the tear, the less muscle you have, the chances of it healing go down. So it can be even 25%. So this is where you have to have a nice discussion with your surgeon who looks at those images on the MRI and can tell you what are your real chances of getting this tendon to heal. And that way it'll help you make a decision on whether you'd like to choose surgery or choose therapy. And just remember, for most tears, there isn't a time window when you have to get this fixed. Otherwise, you burn a bridge and you can't have surgery, or this 80% goes down significantly if you wait too long. There's really a small subset of tears where waiting will make this number go down, or where your surgeon will say you really should just get this done right now because it'll make it a lot more difficult to heal if we wait 1 or 2 months while you try therapy. And again, these are the basics to consider when you're thinking about the treatment of your rotator cuff tear, and it really involves a good discussion with your surgeon who can fill in some of the blanks as far as how bad your tear is. But at least this will give you a starting point to think about how to treat these tears in your rotator cuff.